one step beyond.
Did you know that at this very moment, almost 400,000 people are waiting for an organ worldwide? 400,000 men, women, and children are waiting for a heart, a liver, a kidney, or a lung. An even larger number of families are deeply affected by the illnesses of their loved ones. Almost every year, more than 20,000 people die because an organ could not be found on time to save their life. What if I told you that many of these deaths are actually preventable? Simply by taking one step beyond and changing our ideas and beliefs about organ trade. Of all organs, kidneys are highest in demand, and they can be used from deceased and living donors. Kidneys from living donors, on average, last almost twice as long as kidneys from deceased donors. And because live kidney donation has become a safe procedure with positive long-term outcomes for donors, in many countries, the number of living kidney donations now exceeds the number of deceased kidney donations. And because of medical advancements, it is not only possible to use organs from genetically related donors, but also from unrelated donors, such as spouses, friends, and neighbors. Some countries even allow strangers to donate their kidneys anonymously to patients on the wait list. Yet despite all of the advancements in transplantation technology and the efforts of the transplantation community, organ scarcity has not decreased. In fact, transplantation has become a victim of its own success. As results improved, the demand for organs increased. And organ supply is unable to keep up. Transplant professionals are no longer talking about an organ scarcity. They are talking about an organ crisis. The organ crisis is not only leading to patients dying on the wait list or becoming too sick to be transplanted, it has also led to the development of an illegal organ market, which consists mainly of kidneys. This market coexists with legal donation policies to fulfill the demand that legal donation policies fail to fulfill. And patients are now increasingly turning to this market to buy kidneys. It is an illegal market with great ethical, legal, and medical risks. Most organ trade research is performed amongst the poor, who sell their kidneys on the black market in countries such as India, Pakistan, Egypt, and the Philippines. And their stories are generally the same. They don't receive proper information about the risks of living kidney donations. They don't get screened. They don't receive proper medical aftercare. They are cheated and deceived, often receiving much less than the agreed price, or nothing at all. And because they are ashamed and fear being convicted of having done something illegal, they don't seek help. Patients are victims too. They often fly from abroad to be transplanted in these countries and return home with grave medical complications. And while donors receive little to nothing, some patients are known to have paid up to 200,000 euros for a kidney they needed so badly. So you can imagine how lucrative this illegal business has become. According to one estimation, the illegal organ market generates a profit of more than 1 billion per year. What can we do about this? How can we get more donor kidneys and at the same time reduce the black market abuses? The solution is ethical, it's simple but controversial. We should legalize the trade in kidneys. The problem is, however, that a legal organ market has been deemed too unethical and too controversial to explore and implement. Most countries now prohibit organ trading. I believe we have to challenge these ideas. Allowing organ payments may be a better solution than strictly prohibiting them. Now let's look at the reasons why organ trade has been prohibited. This first happened by the World Health Organization in the late 1980s. Why? There were 4 reasons. Organ payments are likely to take unfair advantage of the poorest and most vulnerable groups, undermines altruistic donation, leads to profiteering and human trafficking, and conveys the idea that people lack dignity, that they are just objects to be used by others. So in short, we are not allowed to donate our organs. We are allowed to donate our organs, but we are not allowed to sell them. The idea is that if we allow organ payments, then it would harm the poor. The vulnerable and the poor would be the first in line to sell their organs. Yet the evidence shows that prohibition is not preventing exploitation and trafficking. In fact, it may be doing more harm than good. In some places, it has driven the trade underground. It has increased the price of organs, making them more profitable to sell. And it has boosted the risk of victimization. So prohibition is not working for those people who are selling their kidneys on the black market, and it certainly isn't working for patients who are dying on the wait list. Other arguments in favor of prohibition are also not well-founded. Some people say that those who sell their kidneys do so out of a lack of free will. However, the present situation has already led to a lack of free will and to exploitation. And who are we anyway to tell the poor that they can't sell their organs, that they cannot make decisions for themselves? We say they are not allowed to sell their organs, but we don't offer them alternatives to improve their situation. Not allowing them to sell leaves them poor. And let's look at the idea that organ payments undermine altruism. There is no evidence for that. Most people who sell their kidneys do so out of basic needs. The need to provide food and shelter for their families. The need to send their children to school. Those are pretty altruistic reasons, right? Payments are not at odds with altruism. It simply depends on what the money is wanted for. And speaking of money, economists have calculated that the benefit to society of one living kidney donation equals 80,000 euros. So everyone profits from just one life donation. The economy, the patient, the hospital, the transplant doctors, health insurance companies, everyone but the donor. Because he or she has to be altruistic. All that most donors receive is a free lunch and a small travel allowance to reach the hospital. Is that fair? And let's look at the idea that organ sales are harmful. Not true. Organ sales are not harmful per se. It all depends on the circumstances which make them harmful. A transplant surgeon once told me that his patient gave his girlfriend a boob job in return for her kidney. Some would say that's a pretty good deal, right? I think that's a pretty good deal. And the case that we studied in South Africa was enlightening too. Donors were flown from Brazil to South Africa to sell their kidneys. But some of them decided to combine their kidney sales with safari holidays. They went spotting the Big Five, and a few others used the money of their kidney sales to buy surfboards, and they went surfing along the Durban coastline. These donors seemed to be having quite a good time over there. They seemed quite happy with the deal, even if they received far less than what the patients paid. Should we regard these donors as victims of exploitation? Or are they parties to a business transaction that share in the profit-making? But still, almost all countries still believe prohibition is the way to go. There is one exception, Iran. Iran has a government-controlled program that rewards kidney donors. Kidney donors receive cash and benefits that can be as high as twice the average annual individual income there. Benefits include a 1-year free health insurance and free business loans. Studies show that these donors are generally quite satisfied with the outcome of their sales. They were able to save a patient's life and could use the money to set up a business, for example. And they are screened and receive proper medical aftercare. And there's more. It is claimed that Iran is the only country in the world which performs transplantations and has no wait list. The system is not perfect, though. Iran allows donors and patients to meet, and they further negotiate and drive up the price, often with help of middle people. And occasionally, violent incidents and conflicts do occur. However, these incidents are nothing compared to the scandals that take place on the black market in countries that prohibit organ trade. I believe other countries should follow Iran's example, with 4 small adaptations. The government distributes the kidneys anonymously, according to the same allocation principles that we have now, which means to the number 1 patients on the wait list. All donors receive the same amount. I think 50,000 euros is reasonable. Contacts, sales, and purchases between donors and patients should be forbidden. And if there is resistance to the idea of giving donors cash, we can think of other benefits, such as a free lifelong health insurance, tax benefits, or a reduction of tuition education fees. We can start the fair trade in kidneys as a trial that we monitor and adapt as we go along. All we need now is a country that has the courage to start such a trial. All we need now are politicians who have the guts to say, it's a disgrace that 400,000 people are waiting for an organ worldwide. I am appalled that 20,000 patients die every year, most of which unnecessarily, for whom an organ could not be found on time. Let's take one step beyond. Let's save lives. Let's allow a fair trade in kidneys. Thank you.